The amount of money we in the United States spent on health care in 2009 was approximately $2.5 trillion. That was about 17.3% of our gross domestic product. And on a per capita adjusted basis, that's twice the amount of money that any other country in the world spends on health care. We have to address this issue of escalating health care costs as a moral problem. When we're thinking about this with what you might call the right side of our brain, we want to control health care costs. We want lower taxes. We want lower insurance premiums for ourselves. We want somebody to do something to get rid of waste and inefficiency, fraud, abuse, whatever in the healthcare system. But then the left side of our brain, so to speak, says, if I'm sick, if I have a serious illness, if I have a heart attack, or if I have a cancer or whatever, I want the very best done for me. And even if something costs $100,000 and will give me 6 extra weeks of life, I want it. I believe I deserve it. Well, of course, if I say that about myself, fairness requires that I be willing to say the same about every other citizen in the United States who will have the same feelings as me. And so we're caught with this divided mind. We want everything from our healthcare system that offers any degree of benefit, but we want somebody else to pay for it. So we have to ask ourselves, what does it mean for us to be a just and caring society when we have only limited resources, what we're willing to pay for healthcare, in order to meet virtually unlimited healthcare needs? The implication of the just caring problem is that the need for healthcare rationing is inescapable. We have to be willing to identify medical circumstances in which certain kinds of costly interventions will yield too little good at too high a cost. And collectively, that is, as a society, in talking with one another, we have to decide that we're willing to deny our future possible selves those kinds of marginally beneficial healthcare resources. Over my 25 years at MSU, and even before I was at MSU, I've put together these public deliberative groups to address the problem of healthcare rationing and the other kinds of problems associated with healthcare policy. And I've been testing different models for creating these kinds of rational, respectful public dialogues. One of the bad things we saw in the health reform, in quotes, debates over the past year is that they were not at all respectful. I've been working on creating models for that kind of respectful deliberation, and I think I've had some success in doing that.